Ladies and gentlemen, good morning and welcome to our fourth webinar as part of the RAC Biggest Weight Losers Challenge. This is ObeFit webinar 4 and our topic is exercise and obesity. Welcome on this Saturday morning, the 15th of January. Our webinar will take place between 11 and 12 noon. Now, there is a direct relationship between exercise and weight loss, and that is why we have selected exercise as a topic for today's webinar. The philosophy is simple enough. You do exercise, it burns calories, it burns fat, it reduces weight. And there is no better reason than that for us to have exercise as a topic today. But there are far more reasons. Now, obesity per se, or being overweight per se, causes a whole spectrum of comorbidities. You could be talking about hypertension, diabetes, hypercholesteremia, the cardiac ailment, arthritis, some forms of cancer, and even anxiety, depression, and several other psychological issues. But what has this got to do with exercise? Now, exercise, in my experience, is the one magic pill, the single magic pill that alleviates or that supports or that remedies almost all ailments. You have a separate, if you were to look at medication, you have separate medication for hypertension, separate medication for diabetes, and so on and so forth. But exercise seems to be the single panacea, the single elixir, the single cure for most ailments. Exercise strengthens the heart. Exercise improves lung capacity. Exercise reduces diabetes. Exercise manages hypertension. Exercise reduces weight. Exercise improves your personality. Exercise relaxes you. Exercise strengthens your muscle. Exercise improves your joints. It fights arthritis. But these are some of the things that I have learned in my experience. And today, we have an experienced teacher who will talk to us about exercise and its correlation with obesity. Ladies and gentlemen, it is my pleasure to introduce my colleague and friend of several years, with whom I have worked across several countries, my friend Dr. Madhurima. Dr. Madhurima has completed her studies in homeopathy. She is a fellow of the Apollo hospitals in preventive and promotive healthcare. She is a diabetes educator, and when she came to Dubai, one of her interests was fitness, and she embarked upon a program of certification in fitness and exercise. She has several decades of experience. She was the head of the Department of Screening in Apollo Indraprastha in Delhi for several years. She evaluated hundreds of clients every day. She was part of the diabetes center in Dubai. She is currently a faculty and a part of Arabian Wellness. Her expertise is vast. She is a counselor in holistic health. She does health risk assessment. She is a prolific speaker. She talks about nutrition, exercise, the management of stress, chronic disease management, more recently, pregnancy and motherhood. Ladies and gentlemen, I could go on and on, but allow me to hand over to Dr. Madhurima Deshmukh.
Doc, you have to unmute yourself. Unmute yourself, Doc.
Can you hear me now?
Yes, we can hear you, Dr. Madhurima. And you're looking very lovely. We can hear you.
Thank you so much. Good morning, everybody. And thank you so much, Professor, for your kind words and inviting me over for this session today. I'd also like to thank and appreciate RAC Hospital and Arabian Wellness for taking up this biggest losers challenge for people. This is going to certainly motivate people and help them in their weight loss journeys, because obesity is really a serious problem. And it's about time that we all pull up our socks and get going. So today I will be talking about obesity and fitness or exercises. So how exercises are going to help in weight loss, and what are the types of exercise we'll be doing, and what is the safety measures and everything. So let's start my presentation now. I will start my presentation over here and we'll discuss all this. Okay, just a second. All right. So can you see my presentation now?
Yes, we can see your presentation, Dr. Madhurima.
Okay, so let's start now. Yes, obesity. It is another pandemic going on these days. We all are suffering from one, which is raging, but this obesity has been steadily and silently growing since past few decades. There are almost 800 million people who are living with the obesity today in worldwide. Out of that, maybe 2.8 million people die each year because of the results of this obesity-related ailments. And also there is a huge cost involved in the treatment of the treatment related to obesities. Just a second, I'm having some problem with my slides. Just a second. Yeah, sorry for this technical errors. So yeah, so I was saying, it is a pandemic, and yes, we had to take measures, just like this ongoing pandemic going on. We had to take some measures to contain this obesity epidemics too. So what is obesity? Obesity is nothing but an excessive deposition of fat in the body. This deposition could happen because of the fat cells getting bigger, or there could be a increase in number of the cells in the body. But why in the first place body stores energy in the form of fat like this? Why there are fat depositions? Because this is a safety mechanism for the body. It stores fat in case there is no food is not allowance or any food, or if the food is not available for certain period, then body can use this stored fat as energy. So little amount of fat is necessary for the body. It becomes a problem only when it is deposited in the excess amounts. So cause of obesity is very simple. So we expend less energy than we consume. And our lifestyle, this modern lifestyle is a major cause for this obesity. We are consuming far more calorie-rich foods and moving much less. So, but there are some other factors also which affect our weight and obesity. Those are genes, your metabolism, your endocrine disorders, and some medications too. They are also responsible for your weight. Who are obese or who are overweight? There are some measures by which we know how we can calculate the obesity. So your BMI, when your BMI is more than 25, you're overweight. And if it is more than 30, you are obese. The body fat percentage in male, if body fat percentage is more than 24, and in women, if it is more than 31, it is termed as obese. Then there are some simple methods which we all can calculate at home, and we know whether you are in the good category or the obese category. So one is Broca's index. That means simply you have to calculate your height in centimeters and minus 100 from that. The amount, the result is your ideal weight. This is one approximate method, but this will give you some idea where you stand. So this you have to measure, and then there is another very easy and very important measurement, that is your waist circumference. Just take normal measuring tape and measure your waist at the umbilical region. So this result should be half of your height. Your waist circumference should be half of your height, maybe in inches or maybe in centimeters. And this abdominal fat is far more dangerous than any other fat in the body, because this abdominal fat is eventually giving rise to inflammations in the body all over, and you will be facing many problems like diabetes, coronary heart disease, high blood pressure, osteoarthritis, sleep apnea. All this is causing because of the excess fat deposits, and these are the perils of obesity. Low backaches, carpal tunnel syndrome. And yes, during this COVID-19 pandemic, we are seeing how obesity and infections, the more the obese people, the more they are having complications. So the correlation is out there. So obesity can be life-threatening. So we must take some measures to contain it. So what we can do, what strategies we have? One is to have your diet. It should be balanced. Calories, whatever is required, only the required calories you should be eating, and it should be nutritious. No crash diets, no fat diets, no sudden decrease of calories to attain your weight loss. No, that should not happen. Then there are exercises and physical activity, your lifestyle modifications. This is also very, very important in your journey of weight loss. Your daily routine, your stress management, sleeping habits, and also dependencies like smoking, alcohol. All these factors will play a role in your weight loss strategies. Then there are some few people who are morbidly obese, more than 40 BMIs, or having some other complications. They will need some medications, medicines, or surgical measures. So they can have. So we have all these strategies to help us. Okay. So let's talk today more about exercises and physical activity. So physical activity is nothing but our daily activities, like we are walking, we're bathing, you're going to work, doing your household works. All this activity also needs a lots of energy. So being active is also a form of exercise. And then there are structured exercises or structured, planned and repetitive movements. These movements are targeted to particular joints and muscles and improving the efficiency of those joints and muscles. So both these activities, physical activity as well as your exercises, is important for losing weight and also for your general health. Okay. So what are the benefits of exercise? Professor has already talked about the benefits at length. There are so many benefits, not just weight loss. Of course, there is a weight loss. How this happens is because we burn more calories when we exercise. Our body uses more calories, and more calories are expended. There is a negative balance, and there is a weight loss. But most importantly, if we want to lose weight and maintain that weight for a long period, or your lifelong, or as long as you are working out, then exercises is must. When you make your eat your less calories, definitely you are going to lose weight. But as soon as you stop your diets, you have seen the bounce back of the weight. Weight is coming back very quickly. If you don't want that to happen, you must add exercises in this. And science has proven that exercises will help in maintaining your weight loss or sustaining it for a long time. And then, of course, there are other benefits like reducing your blood pressure, increasing good cholesterol, strong muscles, diabetes, arthritic pain. Everything, these are a very, very important positive factors of exercises. And not only physical, exercises help mentally also. They help in. When we exercise, the endorphins are released from our brain, and those endorphins are called as happy hormones. So that means they act as a antidepressants. They are natural antidepressants for us. So they help in your stress management too. So it is good for your brain. You will have better digestion, your skin will look good, and your overall health and fitness improves. So many, there are so many motivating factors to start exercising. Okay, so how much do we need to exercise? So 30 minutes of exercises, those are moderate intensity exercises, are enough for your good health and fitness. But if you want to lose weight, then you have to exercise more. I will say at least 1 hour of exercises every day, moderate intensity at least, per day is required. So you can divide it into 2 parts, or you can do it at one go also. Okay, so how to start exercises? Yeah, I know not everybody likes to exercise, or they need too much of a motivation to start exercise. There is always tomorrow, and tomorrow never comes. And for some, they are afraid to how I'm going to do such activities. But let me tell you, each and everyone can do the exercises, even the most obese, even though if you are having any pains or any other constraint, there are exercises for each and everybody. And there are, yes, we all can do it. That is for sure. So start simple. Just choose simple exercises like walk or chair exercises and start from there. Choose exercises which you like. Maybe if you like swimming or playing games, yes, go for it. Set small goals and daily goals. Okay, daily. Today I'm going to walk for 15 minutes, or today I'm going to do some like yoga postures, or you can say sun salutation, just 5 sun salutation. So have this daily small goals and go about it. And yes, don't get blocked on by, I will say, celebrity Insta reels and try to do too many things at too little time. This way you may end up getting hurt, and you may start exercising altogether. So never do that. Go small and start slowly, and gradually increase your efforts. day by day. Most importantly is you have to do them regularly. Don't start today, you have exercise, then 8 days there is a gap. No, this type of irregularity is not going to help. Then one more specific point I would like to stress over here. When you start your exercises, know your correct technique to do the exercises. That is about your posture, breathing, how much intensity you have to do to get more of this out of these exercises. See, many times I see when I go to gym, I see some people, they are exercising on some machine, let's say chest press. They will do like 4 or 5 repetitions. Then immediately they will take out their mobile and then start scrolling. The 5 minutes are gone. Then they will go through some other exercises. So, and there are some people, they are in such a hurry. They will come and immediately they step on a treadmill and speed up and start running just immediately. So both this kind of behavioral is not going to help. There might be injuries, and if you are underperforming, you are not going to get the desired results. So know your exercises, know how to do them properly. You can take help of a personal trainer or experts. Yeah, that is worth it. Okay, so let's see what are the components of the fitness which are necessary for any fitness program. Sorry. Yeah. So components of fitness program is stamina exercises, strength, and flexibility. Stamina exercises are for heart and lungs, strength are for muscles, and flexibility is for joints. So the wholesome, holistic approach to have any fitness program should contain all these 3 components. Then only you will have better heart and lungs, muscles, and joints of the body. So that is the aim. So what are stamina exercises? Stamina exercises are for, as I said, for heart and lungs. They improve the cardiovascular and respiratory health of our body. Examples are walking, jogging, cycling, swimming, aerobic exercises, Zumba, playing games, etc. But now in case of obesity, don't do any high impact activities right now, because you might hurt your knees. So go slow on your knees and choose the low impact activities. Brisk walking is best for you to start with, or swimming is good for you. How much you should be doing as frequency is at least 5 to 6 days, 30 to 60 minutes, either in one go or divided into 2. You can, but you have to exercise this much. And how to walk or how to do your cardio exercises, the intensity should be 60 to 80% of your maximum training heart zone. So what is this maximum training heart zone? So when we are doing aerobic activities, our heart rate is increased, and it should be increased to a certain level to get the most benefit from the exercises. So the formula is 220 minus age, that gives you the maximum heart rate for you. The calculate, and you have to exercise between 60 to 90% of this, your maximum heart rate. So if you want to don't go into the technicalities of this calculating your heart rate and everything, there is one simple method again, is listen to your body, see your physical cues. So when you are walking, brisk walking, you should be attaining such a speed where you start to feel little breathlessness, not too much, but little breathlessness, and you will start to perspire. That is a level where you should be walking for at least for 20 minutes. Then another tip for your brisk walk, I can say, when you start walking, first, of course, start slowly, then increase your speed. And while doing that, just engage your core muscles a little bit. and add normal arm swings. That means fold your arms at 90 degrees and naturally swing the arms. This is again going to amp up your brisk walk. Okay, so engaging core muscles and adding arm movements. Okay, so here Rock Hospital, we have made some videos for your benefit. So this is a stamina video, just what I have spoken. These are the exercises I will be showing. So I will start the link now, and these links are in our website also, and I think you all must have got the links. So you can go and watch them. So now here I will be playing for about 1 minute or so because of the time constraint. But this just to give you an idea about what kind of exercises and how you should be doing it. Okay.
The RAC Hospital Physiotherapy Department presents a 10-minute whole body home exercise program. We start with stamina exercises. Stamina exercise relates to cardiorespiratory stamina. That would mean exercise that strengthens the heart and improve the lung capacity. You start with the spot running or on-the-spot jogging. Older individuals can do a similar on-the-spot walking.
Dr. M, we can't see the exercise.
Sorry?
Minute.
We can't see the
We can't see?
exercise. No,
Oh,
we can hear the
okay.
sound, but not see the exercise.
Okay.
The RAC Hospital Physiotherapy Department presents a 10-minute whole body home exercise program. We start with stamina exercises. Stamina exercise
Can you see now?
relates to
No, we can't,
No?
stamina.
but we are trying to connect to that.
Exercise that strengthen the heart and improve the
Doc, you could go on with your presentation, and we will come back to this as soon as we are able to connect. Okay?
Okay. Okay.
We will let you know when we can connect, and then we will get back to you.
All right. It said your screen. Okay. All right. All right. Then maybe at the end of the presentation, we can run these videos.
Yes.
Yeah. Okay. Yeah. So those are some of the videos we have, and yes, you can always watch them. Link will be provided to you. Yeah, and you can watch and exercise looking at them. So next, come after the stamina, next exercise are strength exercises. Strength exercises are meant for muscles. So these exercises like your push-up, sit-up, squats, using major muscle groups of muscles, they improve the efficiency of your muscles. Why exercising muscles is important? Because good muscle mass means good resting metabolism. That is, even if you are not exercising, your muscles are using the energy, and you are spending energy while even if you are not working, or if you are not having any physical activity, you are losing more calories. So yes, you must do some strength exercises. Again, there is this myth that if you want to lose weight, only cardio is going to be helpful for you. That is not a case. You have to have a good muscles for you. So when I say you have to do muscle exercises, that does not mean that you should be going for six-pack abs or going for building muscles like weight builders do. No, that is not. That is not what I meant, but improving the quality of the muscles. So strengthening exercise can be in the two forms, that there is no need for you to go to gym also, that you will need some equipments. No, that is not the case. Even using your own body weight, we can do the strengthening exercises. And of course, there are free weights and gym machines also. So how much exercises we should be doing? So frequency to do muscular exercises is about 2 to 3 times in a week. The intensity is as per your capacity. You have to start slowly, and then slowly you have to increase the weights and increase the repetitions of the exercises. Usually 10 to 15 repetitions and of 3 sets are enough. So how you can exercise your muscles? You can make a zones, 3 zones of the body, like upper body, like your chest, back, your bicep, tricep, arm muscles. Then lower body, your squats, your quadriceps and leg muscles, then core. So you can have alternate days, you can exercise zone wise, or you can have at one session, you can have a whole body exercises incorporating all this upper body, lower body, and core exercises. Here, just remember, whenever you are doing muscular exercises, remember to exercise your flexors and extensor group of muscles too. That means, suppose if you are doing chest exercises like a chest press or bench press, remember to do your back also. Back exercise, like a pull-ups you can do for the backs. Or if you have done the biceps exercises, then go and do your triceps. So equal and opposite movement should happen to balance out the exercises. So this is for your strength training exercises. I think we'll try your videos at the end only. Okay. Let's go further. And after stamina exercising, there are flexibility exercises. So flexibility are for your joints and ligaments. They improve the ball balance, they support your joints, and they prevent the injuries. So flexibility exercises are also important. So in flexibility, we can do 2 types of exercises, like mobility of all the joints, and static stretches, stretching for the ligaments and muscle fibers. So mobility exercises are mobilizing all the major joints, starting from neck to toe. So, and we have to mobilize them into their full range of motions. Many times we are sitting at our desk, we are not even looking up, or we are not using our shoulders, we are not even making our hands up. So make a conscious effort and do the mobility exercises for all the joints. These exercises can be used as a warm-up exercises too. You can, before your main exercises. Frequently, it's daily. We have to do these exercises morning and evening. Yeah, because these are very important for your circulation also. And each joint should be mobilized for at least 8 to 10 times. These are the examples of static stretches. This we should be doing after our main session. As a cool down exercises we should be doing. And stretching, or maybe your quadriceps, hamstrings, is to hold the stretch for 20 to 30 seconds at least. Okay. Shall we try, or?
Yes, Dr. Madhurima, would you like us to show the 3 exercise videos?
Yeah, I think I will just try. Let's see if.
No, we'll do it for you.
Okay. All right.
Can we start with stamina, if you don't mind?
Yeah.
Ma'am?
Sure, I will go back then.
No, we'll upload it for you.
Okay.
Stamina.
Yeah.
Go ahead, Neha. Go ahead and start, Neha. Stop sharing your slides, then we will be able to upload the video.
I should stop. Okay. Yeah.
those were some of the stamina exercises, and we will now exhibit some of Dr. Madhurima's free hand strength building exercises. Carry on. Pass forward. I hope that was good enough, Dr. Madhurima.
Yes.
Thank you.
People. Okay, sorry. I'll share my screen now. Okay. Okay. So I think everybody has had some idea about how to do these exercises, stamina, strength, and mobility, and what are their importances. Yeah, and these are some of the yoga postures now you are seeing on your screens. Those who have, many people of us now have low back pain, so that's why I put some exercises together. So anytime when you come home or in the morning also, you can do this yoga poses for the lower back pain. Like there is a cat and cow pose, bridge, child's pose, backward bends, and cobra pose, etc. Just and you have to hold them for 10 seconds like that, and 4 to 5 repetitions each. Then there are office exercises. Like I said before, physical activity throughout the day is also must. Don't think that, okay, I have exercise in the morning for half an hour or 1 hour. Now I'm free to sit the whole day. I'm sitting in front of my desk or in front of TV. No, that is not going to help. You have to be active throughout the day. I would suggest put an alarm in your mobile for every 1 hour or so. So even if you are busy, you can just get up and stand up and type whatever you are doing, or just have select 2 to 3 activities like your neck stretches, shoulder stretches, your leg raises. All this can be done seated, sitting at your desk. Or you can just move about, go to washroom and loosen up your body and come back, and you'll feel the difference. Not only your physical body is getting circulation and is doing good for you, but also mentally you will be much more alert after doing these exercises. So remember to be physically active throughout the day. Okay, so now we are seeing so many exercises and how to do them. So how to make a program out of that? How your ideally fitness session should look like? There are some points you must remember. So when you start your exercise regime or make a plan for exercise, that session should have warm up. Then there is main session of main exercises of muscular exercises, and then the cool down sessions. So warm up, why warm up is important? Because if you just suddenly go and start doing your weightlifting or any other exercises, your body is not ready for this kind of exercises. Your muscles are actually cold. So there is not much circulation happening. So warm up will increase the circulation, make your muscles warm and ready for the exercises. This prevents the injuries to the joint. Just remember, your muscles fibers are like elastic rubber. So if it is too tight, it is going to break. So gradually warm up. And mobility exercises, which what we have seen, that can be used as a warm up also. Then select the zones of the body, like maybe you can go for lower body, upper body, core, or you can do at one day or alternate days too. The choice is yours. And when you end your sessions, exercise sessions, you have to do it slowly too. Slowly cool down and do the static stretches. Why? Because static stretches, they will prevent or they will reduce the DOMS. DOMS are called delayed onset muscle soreness. Many times you must have seen, after you have done some exercises, your muscles and your body gets sore. This happens because there are micro tears in your muscles. But don't worry, this is a good sign. Having a little soreness after your exercising means you have worked up your muscles and you have put enough efforts on that muscle group, because that is how the muscles grow and that is how they become fit. So little soreness is fine, but as you go along, as you are regular with your exercises and you are stretching properly afterwards, this soreness gets less. And one more thing, when you are doing your cardio exercises and if you're running and if you suddenly stop, you might feel dizziness. This happens because muscles are not they were contracting and you suddenly stop, and the pool of blood is still in your lower extremities. So you might get dizziness. So to avoid all these things, always slowly stop your activities. Whatever main activities you are doing, you should be stopping them slowly and coming to a stop. Yes, always be safe when you are doing your exercises. In the beginning, do exercises under the expert guidance. And start slowly, gradually increase your intensity and frequency of the exercises. Proper warm-up and cool down is important, like we have said. Yes, maintain your good postures, your breathing pattern, wear proper shoes, even that is important. Even after all these things, sometimes you may get some injury or sprains. In that case, if it is not much, you can have this RICE protocol. RICE protocol is nothing but first rest that ankle or whatever the muscles it has been affected, rest that part, put ice on that, maybe 5 to 10 minutes, put compression band and elevate the portion. So this is the first aid. But see that even after this, the pain is not reducing, or if there is too much of a swelling, then of course take a medical attention. Also, see that you are not having any dizziness, palpitations, or fever, or chest pain, etc. when you exercise. If there are any of such signs, ask the experts or take medical attention. Yeah, and one more thing, when to exercise. Do not you can exercise at any time of the day, but see that after having a full meal, you don't go into the exercises. But at the same time, you should be having a small carbohydrate or small snack before your workout, and you should be having some snack after your post-workout also. So that should be like a protein-rich foods. So these are some of the guidelines for your exercises, pre and post exercises. Yeah, and that is how you should be planning your exercise sessions. And this is one of the sample again we have compiled together of all these exercises, cardio exercises, your strength exercises, and mobility exercises. So this tip is also there on your website. You can go and take a help of this. Okay. Yes, so that is where I come to the end of this presentation. So I wish you the best, and I would like to say exercise for health, and you'll get youth and beauty in bonus. That is for sure. Stay fit. Thank you, sir. Thank you, doctor.
Thank you. Thank you. Thank you, Dr. Madhurima. And I'm glad that we were able to put up the exercise videos that you wanted to show. Thank you very much for the abundant knowledge that you made available in your presentation. Basically, what you were saying is that we should all, and we could all exercise in spite of being overweight. We should do it slowly and gradually, maybe start with 5 or 10 minutes. Walking is something you recommended. Exercises like joint mobility, some light strength exercises, deep breathing exercises. You even suggested yoga. Thank you for that. We will be having a yoga session later for our colleagues. And we may inform you that all the exercise videos that Dr. Madhurima showed is in fact available currently on the site. Participants may please log on to the ObeFit site and have a look at those videos. I'm sure you have several questions, and Dr. Wilco has been collating these questions, and I will now pass on the mic to my very able colleague, Dr. Wilco, for his question and answer session.
Thank you, Professor Kennedy. Thank you, Dr. Madhurima, for a wonderful presentation. As usual, you have given every component of the exercise benefit and what to do. And still, as surprisingly, every time we are receiving very good questions. Even this time we are having wonderful questions, even in mail also and in chat also. I would like to start with one interesting question. There are two questions similar to each other, but I will take one by one. Please, let me see. Yeah, Vidya is asking if the lady is very heavy weight, means abdominal fat is very heavy, abdominal fat. What kind of exercise can we do? And will it affect badly for PCOS patients? Dr. Madhurima.
Yes. Abdominal obesity and PCOC, yeah, many times, many women have this problem. So for reducing abdominal obesity, there are nothing like, okay, spot exercises only targeted to your abdomen and your abdomen will reduce after doing certain exercises. That is not the case. Many people, they go for crunches or your sit-ups, thinking that will reduce their abdominal fat. No, fat loss does not happen like that. That is why we have discussed in detail so much about the components of the exercises. So you must be doing your cardio, you must be doing your muscular exercises and being active. So all this along with your diet, it will help you in reducing weight. And yes, diet and exercise both are shown have wonderful effects on reducing your PCOS symptoms also. But yes, you have to get going and you have to be consistent. Don't lose heart. Okay, I'm doing this for 2 months and nothing is happening. No, your metabolism is slow. That has to be amped up and it will take some time. But surely you will get some results.
Thank you, Dr. Madhurima. It was a wonderful answer. And please put any queries regarding exercise because we have already covered that in previous session. So these questions were already answered. I was wondering for this wonderful question. Mr. Harsaj Singh is asking, you have mentioned about the components of exercise. What should be the ratio of various components of exercise for a grossly obese?
Okay, so he means to say how much exercises one should be doing if the person is obese.
Yeah, in different components. You have mentioned about stamina, strength, and mobility.
Yeah.
So how much time they should spend on each component?
Yeah. So like we have discussed this for the stamina exercises or your cardio exercises, you must be spending at least, if you are obese, I will say spend at least 45 minutes to 60 minutes of stamina exercises. So that you can divide, maybe morning half an hour, evening half an hour, that way you can do. Stamina, strength exercises, that is for your muscular exercises, you must do at least 3 times in a day, 3 times in a week, sorry. And that can be done again 45 to 1 hour minutes of the muscular exercises or the gym exercises or free weights or the body weight exercises she can do. And mobility exercises are like they should be done daily, and even you can do 2 times in a day. You have to just mobilize your joints the whole day. So yes,
Yeah.
these are components, and this is how obese persons should be doing. This much is required.
Okay, thank you. Mr. Bharat is asking, popularly it's a very known concept that intensive exercise training is very good for weight loss. Is it safe or do you suggest for intensive exercise?
Yes, this is the very common questions we get. Yeah, high intensity and like a fat diets, even in the fitness, there are so many fats come and go. Sometimes people will suggest cardio, only do the cardio, extreme cardios, or sometimes weight training. But I would say high intensity exercises, of course, they are good, they are important for your lungs, also for your cardio health. But if you're obese, if your weight is more, doing high intensity exercises are going to put pressure on your knees and other parts of the body. So just because they are good, you should not be going and doing them right away. You have to first you have to improve your fitness level, then you can do those under the guidance. But first I will suggest, if you are obese and if you are a beginner, start with your normal activities or start slowly, and then you can have little component of high intensity exercises, but not every day and just going and doing high intensity exercise. That is not good. And of course, and for the fat loss, it is seen moderate brisk activity. What is this walk? Doing for the longer time is going to use your fat deposits. And doing high intensity exercises, you are going to use your glucose storage. So even that is a difference there. So fat loss versus your glucose metabolism. So
wonderful justification, Doc. Wonderful justification. Everyone should keep in mind, especially this point. If you are doing an intensive exercise, you are working for your calories, sugar burnout. But if you want to reduce your fat, then you should be doing a low intensity for a longer period. Wonderful justification, Doc. There are two questions, similar questions. One Parampreet is asking, and one Poon Chan. They are asking a similar type of question. BMI is 28. I have a thyroid problem, and they are on medication. Please suggest a proper exercise to help lose weight. You know, for people suffering from thyromegaly, are very difficult to lose weight. So, Doc, your suggestion.
Yeah, again, my suggestion is the same. First, do your cardio exercises and do your muscular exercises. Amp up your muscles more, because more good muscles means good metabolism, and this metabolism is going to help you in your thyroid functions also. And if you have abdominal obesity, try to reduce your weight. So reduce weight by your cardio and muscular exercises.
Yeah, great. Mr. Prashant is asking regarding the macronutrients, which previous speaker, Ms. Ruba, has already covered that. But I would take second part of the question over here. Many people come across whether the gym exercise is an hour of gym exercise is good or an hour of swimming exercise is good. So what do you prefer, Doc?
Yeah. So swimming, as we are saying, is a cardio exercises, which is good for your heart and lungs. It will improve your cardiac output. Of course, it is very good on your knees, also your joints and your muscle also. It's actually a wholesome exercise, swimming. And whereas in gyms, you are targeting a particular group of muscles, maybe your thigh muscles, your chest muscles, back muscles. So it depends. What is your goal? What is that you want to achieve? So if you want to achieve your considering the weight loss challenge, for the weight loss, yes, swimming is very good. You can have your cardio activity as a swimming, you can swim for maybe 5 to 6 days in a week, and also add 2 days of weight training in the gym to amp up your muscles. So that will be wonderful.
Thank you, Doc. Mr. Muhammad Adnan is asking, already you have answered it, but again, I'm taking this question. I'm walking for 90 to 120 minutes per day. Do I need to do other exercises also?
Yes, very much, very much. That is what we have been saying this in this presentation, because like a balanced diet, your exercise should be balanced one. Only walking is not going to help you losing weight. Walking is good for your maintaining your health and for your normal fitness and health. But if you want to lose weight, your exercise should have stamina, strength, flexibility. So you must, along with your walking, you should add some weight training. So maybe on the day of weight training, you can walk less. No need to walk for 90 minutes. You can just walk for 1 hour that day, and another half an hour you can go for your exercises. That is your muscle exercises.
Very clear message, Doc. Mr. Prashant is having another question. Can you please suggest the time gap? This is very frequent question we come across. With the time gap between the meal, before and after, and any exercise. What should be the gap?
Yeah. After having a full meal, there should be a gap of at least 2 hours. Suppose if you had lunch and then you want to go to exercises, wait for at least 2 to 3 hours after full meal. And but when you go for exercises, have a small snack, maybe like a banana or a half a banana. So this will give you some energy to do the exercises. And post exercises, you also, after half an hour, you can have a snack which has a more protein in it. So that should be a gap. Okay, full meal 2 to 3 hours. If you're if you have maybe in the evening or in the morning, if you want to exercise this on an empty stomach, still don't go totally empty stomach, just have a little piece of fruit, and after exercises have little maybe you can have a milk or any other protein snack.
Yeah, thank you, Doc. We are running out of time, but I will take one question. But before going into that question, I would request all the participants, we have already suggested you, if you have any comorbid conditions, any medical conditions, if you require any support, please write a mail to support@track weight loss challenge, and we'll be happy to support you along with that. I'm taking this question, the last question. I am 43. Just a minute, please. I'm 43, have asthma, and I'm 107 kgs weight. So it's hard to do an exercise for obese people, especially with asthma, and that too, he's on medication. If swimming is enough, he has knee problems also. So,
Okay.
Doc, what is your suggestion?
Yes.
Asthma with knee pains also, and on medication for asthma.
Yes, this is a very good question, and this is very, very important, because for people those who have some kind of medical ailments, first and foremost, they must take a clearance from their doctor. Just don't go about and just because even if we are saying just go and start your exercises. No, first have the medical checkup done, get a clearance, then do your exercises. And in case of asthma, yes, swimming is good. And even after the swimming, he can have some other aqua activities. There are many exercises which can be done in the water, in the pool. So even his knee joints, that will be get benefited, and he will also get benefits of other components of the exercise also. So you can swim and do the other exercises in the water itself. So that way it will be beneficial for him.
Wonderful suggestion, Doc. I'm taking the last question. All kind of exercise will be done. Already you have answered this. Again, I'm taking this question because people have many confusions like this again. Early morning exercise is only the possible time, or because the person is working in a night shift, what time they can do? Already you have answered, plus Doc, again, you can answer, please.
Yes, for exercises, yes, any time is good. But morning time is good for many because that is the time which is in your hand. Because after that you are going to work and then you get stuck up somewhere. Then when you come back, you don't have enough energy to do the exercises, etc., etc. So morning, that is why morning is the best for in this perspective. But there is nothing like that you should be doing exercises in the morning itself. It is not like that. Morning exercises, yes, you can are good when where there is like a yoga or they are not very intense cardio. Those kind of exercises you can do in the morning, and in the evening you can do the more strenuous or more cardio related activities in the evening. For he's having night shifts, so yes, before going to the office in the evening also he can do the exercises.
Yeah, thank you, Doc, for a wonderful suggestions and answers. Professor Kennedy, it's over. You can take over.
Thank you, Dr. Wilku, for that. And Dr. Madhurima, thank you so much for your answers. There was great wisdom in all your answers. I'm absolutely delighted with the answers you gave, which are simple and straightforward. You suggested moderation in exercise, and you justified it by saying the more moderately you exercise, the longer you can exercise, the more calories you can burn, and that is excellent. You then said that there is no use of doing only walking or only gym training. It is better to do stamina, strength, and flexibility. So you can start with your walking after a warm-up, etc., then do your exercise program. And it's good. You suggested that you do strength training on some days, you do your walking and swimming on some days, you do your yoga and mobility on some days. That was an excellent. It was the same way as you have a balanced diet, you suggested balanced exercises, and that was good. You suggested exercise in the morning or exercise in the evening. You told us as to what time we could exercise. I believe that your question answer session has answered almost every question that anyone could possibly have on exercise. But for the information of all our participants, do remember that all our webinars are recorded and are uploaded on the website. So please have a look at the website from time to time for more information on each of these webinars. I'd like to thank Dr. Madhurima for her excellent rendition on exercise. I'd like to thank Dr. Wilke for his question and answer session. I'd like to thank all the participants for listening in to us. I would like to thank our sponsors whose names appear at the bottom of each of our brochures and elsewhere. Without their support, we would not be able to sustain our activities for the 10-week period. Every Saturday, we have a webinar between 11 and 12 UAE time. And we've had a webinar on the medical aspects. We had a webinar on the nutritional aspects of obesity. Today, we had a webinar on the exercise component of obesity. And next week, please tune in for an exciting talk by an outstanding speaker, another outstanding speaker who will be talking about the psychology of weight loss. The psychology of weight loss. It's not just what you do, it's your attitude towards what you do and the different other aspects about obesity from a psychological perspective. So we have that one next week. Ladies and gentlemen, friends, colleagues, thank you so much for sitting in and listening to us. We look forward to being of service to you again next week with our next webinar. Thank you and good day.
Thank you.